Kay Doc, sobrang galing niya, na-amaze talaga ako kasi alam na alam niya yung ginagawa niya and sobrang expert niya. Hi everyone, it's me, Christine Lim, and I'm currently at CSA Medical Aesthetics, and I'm very, very excited na ma-meet ko si Doc Contessa kasi it's been a while. Ang dami naming chats and ngayon lang nagtugma yung schedule namin. So I've known CSA sa mga friends ko from Pampanga and also sa mga relatives ko na nakatira here sa Pampanga. And I'm very, very excited nung na-schedule ko na talaga yung appointment ko here. And what I'm excited about is to try the Rejuran. So it's for the elasticity of your skin and also to boost your natural collagen. So, you know what? Makikita mo sa skin ko, it's okay, but it can do better. Like, mas may i-glow pa yung skin ko. So, I'm very excited to try and let's see kung ano yung results after. Bye!
Hi everyone, I'm with Christine, and Christine is very young, early 20s.
Yeah.
Okay. So, she's so beautiful already. She has a beautiful skin. And at this age, you want to do a so-called kind of like prevention also. So nowadays, we have a lot of like oxidative stress from the environment, like sun exposure, environmental hazards. So what we're doing is the so-called rejuvenation or prevention. Okay. So we're looking at Christine, and in terms of the skin quality, there you go. That's our target. So upper third, middle third, lower third of the face. So on the upper third, you can check presence of. So in the past, Miss Christine experienced the so-called acne problems. So there will be souvenirs from acne marks, okay? And then if you look also, some redness there or erythema, we call them erythema, and some like blemishes. And then mid-face, same thing, like some tiny dark spots or pigmentations and a little bit of redness or erythema and some uneven skin tone. And same thing on the lower third you check. So also, there you go. Some signs of redness, some signs of like, you know, from the past, signs of irritations in the past, okay? So because of like environmental hazards. So now what we're going to offer for Christine will be a treatment that will also help in repair of those skin conditions like the blemishes, irritations and redness, okay? Even the marks from the acne. Plus, it will also regenerate the skin inside. Apart from repair, you also want to maintain closed pores, balanced skin tone, smooth skin, young skin. There you go. Radiant, glowing skin. That's the goal, right? Yan, perfect skin, flawless. Okay. So the treatment that we will be giving for Christine is the so-called polynucleotide treatment with the brand Rejuran. Okay. So it's been, you know, in the social media, it became famous for, you know, being labeled as sort kind of like from the salmon sperm. Because Rejuran is polynucleotide, which is a DNA fragment derived from salmon. Yon, it's a salmon DNA. Okay? So, now for the treatment. I'll be working, actually, it should be full face treatment. We want to help the skin regenerate and repair. So, I'll start with the mid face to the lower face. Now, Christine has low threshold to pain. So, my approach for her will be the so-called cannula technique. Okay? And then on the upper third, I'll be doing combination. So, sa upper third, a little bit of the microneedling technique or the manual technique with those papule methods. Okay? So, I'll start with this part here, lateral cheek area. Okay, lateral cheek. So, the entry point, there you go. And I'll make a tiny prick. I'll pinch the skin like that. tiny prick here. This is a small needle, and I have my Rejuran here with a cannula gauge 25. So we'll be delivering. Ideally, you deliver it in the layer where you have fibroblast cells. Fibroblast cells stimulate collagen synthesis and elastin synthesis and glycosaminoglycans. So I'll be delivering medial cheek to the lower part of the face to the posterior aspect. Okay? I'll start na. Okay? So Christine, this is just gliding our cannula first. So we'll be doing a so-called fanning technique. Okay, that's one. And I'll be delivering the product already. How's that? It's okay? So I'll go here again. Fanning technique. I'm just doing tenting of the skin. And then we'll deliver it like that. So we need to be in the very superficial layer because we want the fibroblast cells to be targeted. Okay? So going back into the entry point. So I'll deliver again here. Lower part of the cheek. Okay. We're still good. So this is one method, cannula. You can still do the manual method of papule technique. You can also combine it with the so-called microneedling machine. So we'll go here now, the back part, and then going at the back. We're still good. So simple technique. So we're just delivering the polynucleotide. These are DNA fragments, and they work at the cellular level. They will stimulate collagen elastin formation. They will revitalize, regenerate, and repair. So those with problems of skin redness or blemishes, aging skin, and even those with fine lines, wrinkles, as well as acne scars. Okay? So we're at the back now. Kaya namin ni Christine yan. So we're doing this right side of the face. Yan. So single entry point, deliver it all throughout. So this is just a first treatment for her, first session. Actually, you can do sessions of this kind of more polynucleotides. So I'm going superficial. It's just that at the posterior part, we have resistance because we have a lot of connective tissue fibers here. And going posteriorly and going there. Okay? So we've done the right side. Now let me just do a little bit of the upper third half, right side. Now my technique will be so-called very tiny papule technique or epidermal nappage or dermal nappage technique. So I'll start with the... So there's also a so-called papule technique of Rejuran delivery. Like for example, you inject here. So you will see tiny bumps only. Tiny bumps. There you go. So more visible on the forehead area. And usually this will subside in a day. The others like less than a day. The others in 3 hours. The others in 6 hours. Okay. So this is also a very good technique to deliver your polynucleotide. Now you can combine polynucleotide right now with micronutrients. If you have like for example the bionutrient MCTF and other skin booster materials, you can do combination. Okay. So we have tiny papules, tiny bumps on the skin. Now I notice, Christine, you have volume loss on your temple. You need to restore volume there. Okay, so we've done the right side. Let's just proceed to the opposite side.
Ayan, so doon na yung treatment, guys. As you can see, my face is a bit red. Pero kung sa pain tolerance ko kasi is mababa talaga. So, medyo nasaktan ako, but not compared to yung grabe talaga ka-deep na mga skin boosters. In terms with, like, kay Doc, sobrang galing niya. Na-amaze talaga ako kasi alam niya yung ginagawa niya and sobrang expert niya sa mga skin boosters. Na-amaze ako on how she explains everything bago niya gawin, and napansin niya, sasabihin niya talaga sa'yo kung ano yung dapat at kailangan. So, I'm very, very excited na makita ko yung results within maybe tomorrow meron na results or maybe after a week or 2 weeks. Ayan. Make sure to visit CSA Medical Aesthetics here at the Infinity, the shops at Angeles City, Pampanga. Bye guys! I'll see you on the next one.